Again, an important topic for the MRCP Part 1 and Part 2 theory examination. Expect at least one question from this particular topic in your exams. This is a very difficult topic as such, but I've tried to simplify it as much as possible so that it's easy to rule out the options. Now, post myocardial infarction, there can be various types of complications. Immediately after the admission, if the patient complains, if the patient is having cardiac arrest, and you can note down rapid irregular waveform on the ECG, that is ventricular fibrillation. Now, this is a tachyarrhythmia, which is the most common cause of death in post myocardial infarction. Now, between 1 to 7 days after MI, if the question denotes widespread, that is early to mid systolic murmur, hypotension, ST elevation, pulmonary edema, then there can be, these are the signs and symptoms suggestive of acute mitral regurgitation. And this will be either due to the ischemia or the rupture of the papillary muscles. In the first 48 hours, if the patient complains of pleuritic chest pain and there's a pericardial rub, there's tachypnea, tachycardia, and there are global ST elevation, and the PR is decreased, short PR interval, then it will be due to acute pericarditis. In this case, you have to treat the patient with NSAIDs and colchicine. If it is 2 to 6 weeks after myocardial infarction and the patient is having fever and pleuritic chest pain, and this is the only condition with fever, pericardial effusion, autoimmune reaction, there's usually autoimmune reaction against antigenic proteins which are formed as the myocardium recovers. So this is a particular syndrome called as Dressler syndrome. Now in the questions you will be confused between these two, because both of them have got pleuritic chest pain and fever is very generalized symptom. So you have to check for the duration. If the question is saying first 48 hours or first 2 days, then it will be acute pericarditis, whereas this is basically an autoimmune reaction which is subacute. So it takes around 2 to 6 weeks and it is associated with fever. So both will have pleuritic chest pain, but the duration will get you the answers. Then again, 1 to 2 weeks post MI, if the patient has got acute heart failure secondary to MI, and there is raised GVP and JVP and pulsus paradoxus, and there are globally decreased heart sounds. So in this case, it will be left ventricular free wall rupture. Okay? There is increased JVP in here. In first 4 weeks, if the patient after post myocardial infarction, if there's persistent ST elevation associated with left ventricular failure, which will be associated with bibasal crackles, and you will hear S3 and S4 heart sounds, this will be due to left ventricular aneurysm. Now here this is 4 weeks, this is 1 to 2 weeks. In the first week after MI, if there is acute heart failure with pansystolic murmur, then it is mostly due to ventricular septal defect. Now there are other complications like cardiac arrest and bradyarrhythmias and tachyarrhythmias. Most of the questions will be asked on these 7 or 8 topics in the examination. So one needs to be really thorough with this and expect at least one question on this topic. Thank you.